What is up? Today is a great day, and I'm super, 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 super excited in what I'm about to tell you. Things are changing, and things are changing in a great way, and they are changing fast. Before, we've talked about misalignment in the healthcare system. We've talked about how fee for service or simply getting paid to just do stuff, regardless of what happens to the patient, how that can contribute to burnout and contribute to a lot of spending and a lot of heartache and drama, likely. And not just for the majority of us, because it is in the majority of us, but there's also hope for those who are in the margins with some very, very significant conditions that a lot of us deal with. Right now, there's a shift happening in how we get paid as healthcare organizations, as healthcare providers, and that is going to come down and affect staff as well. Right now, it's mostly in the outpatient space, but believe you me, when it's all said and done, this will be how it is. And I will show you exactly what I mean by that. I will prove it to you that even though this is unprecedented, right, with the access model and value-based care and how the government, CMS, is rolling this out, but based off of how CMS has acted in the past with other with with other initiatives before scaling to all disease states. Like, this right here is just the beginning, but this beginning is going to be absolutely huge. Let me show you what this has to do with your bottom line. Okay, so camera here. This is where things get exciting. Do you hear me? Because guess what? Again, we know the definition that we're working with when it comes to technology. Technology makes it possible for us to do more with less. Technology makes it possible for us to do more with less. So when we have increasing patient census, right? When we're becoming more and more saturated with patients, with certain conditions, when we are in that place, that's where technology can help us, because technology can help us address more patients, so higher volume of patients, more quality, so higher quality of care, better care delivery, right? And of course, scale. We didn't go to school and go through all of this stuff just to take care of one patient. We take care of one patient at a time, yes. But in this reality that we live in, right, where we have these payers, we are responsible for taking care of whole communities, whole census, whole groups of patients. And how we're doing it now is not working. It's not enough. We need to do more. We need to do more. We need to reach more with the little that we have. And that, again, is where the technology comes in. In order to participate in access, one of the requirements is that, as I said, you have to actually be using you have to be using that technology. So gone are the days, at least in the access model with your access population, with this line of business, because this is a line of business. Don't get it twisted, my friend. This is a line of business that is aligned with better outcomes for people, with results for your patients, okay? But with this technology, they're saying, no. Listen, we don't want crusty old faxes. We don't want crusty faxes. We don't want emails of PDFs. We all know the headache of quality reporting, of filling in all these forms and all of this stuff. And then, of course, you have to hit the fax machine and kick it 5 times to get that thing to go. And even then, it might end up in some graveyard somewhere. We have no idea where that fax ended up. Nah, the government said, listen, we are digital. It is 2026 right now. The government is saying, use technology. Use technology to support your care, to measure the outcomes and report them with technology. So you have to use, you actually have to use FHIR and APIs and whatnot. And not everyone's going to be able to participate in this line of business, which is going to become the status quo. Not everyone will be able to. Why? Because not everyone has access to, not everybody knows which to trust or to use. Not everyone can build options, but that is what is required in order to move forward in what is the new era, the new aligned era of healthcare in this country. Now, let me go a step further. I'm over here wilding out in front of the camera. What that means is that it's not just CMS, it's not just Medicare Part B, but private insurance has come out and said, you know what? We want a piece of this. We want a piece of this innovation. We want to get involved in this. Believe you me, if this is 2/3 of the population of Medicare Part B patients, and you know the diagnoses that we're referring to, hypertension, like what? Last time I checked, it was something like 25% or over 25% of the people, but this is an old statistic, but over 25% of people with hypertension have no idea that they actually have hypertension. It's whoa. It's wild. But let me get deep. It's still early right now, but that is just right now, and that means that they smell money is in this. Money is in this. There is money and people getting better. And that money is, there's money in it, but there's also value. There's tremendous value in people getting better. One example, I believe that one of the major reasons providers, nurses, folks who have gone to school get burnt out caring for a patient in the outpatient world is because they desire to make this impact. They went to school, they jumped through hoops, they went through all of this stuff for patients to get better. But instead, they have to jump through all of these hoops, send all of these faxes, click all of these buttons, and have no idea if any of that clicking and fax machine kicking actually benefits the patient. What people want to do in healthcare delivery is make patients better. That's why we put up with being in healthcare still, is because we want to make patients better. Now, tell me, now that we have alignment with these disease states right now, and I promise you that will expand. I promise you that will expand, and I will get to that in a minute. I will prove it to you in a minute based off of history, right? But imagine not having to work against a system every day for you to make a patient better, because the business model or that line of business, right, is aligned with exactly what your desire is, which is for the patient to get better, which is what the patient desire is. The patient wants to get better. What would that do with trust? Could joining access make you more trustworthy as a healthcare provider? Because the public knows about access, or at least they will when I'm done. but the public knows about access. Will that make you more trustworthy? We spend all this time talking about, oh, the patients, they don't trust us. They don't trust us. We worried. They don't trust us. We should be asking ourselves, are we trustworthy? How do we grow in trustworthiness? And I think one of the first ways to grow in trustworthiness is to put your money where your mouth is and to be aligned with the patient's best interest, which is to be awesome. Which is to be awesome, which is to have better outcomes. So there's that. What does that do to burnout? What does it do to burnout? Especially knowing that you don't have to kick the fax machine anymore. What does that do to burnout? You literally get to work toward, you literally get to have your cake and eat it too. Do the work that you believe in. Give the care that you desire to give and get paid to do it. I think it's a beautiful thing. And I think since we finally have that alignment with the reimbursement and whatnot, I think we're going to see a lot finally change. I think we're going to see a lot finally change. And it's wonderful because, again, now the government, these payers are putting their money where their mouth is. You now have the opportunity to put your money where your mouth is too for these patients. And when I say put your money where your mouth is you get to make money. Make money. Support yourself. Offering the type of care that you've always wanted to offer, supported by technology that helps you work smarter, not harder. Low lift technology, because it needs to be low lift. That's for sure. Unless you want to be clicking around a lot more, right? And then, of course, the requirements for reporting and reimbursement and whatnot. I think it makes sense for all of that to be automated. I think it makes sense for all of that to be seamless as well. Now, let me get back to my point that I was sharing with you guys about how I believe we are going to move Mark my words, CMS might be starting, or not just CMS now, CMS, Humana, CVS Health, come on, UnitedHealth, what? Blue Cross Blue Shield of various state and insert state name here, right? Now they're saying for these chronic conditions, we're going to align in this way. Mark my words, that will expand to other disease states. I see sepsis coming. Oh, yes. I see sepsis coming. I see complicated UTI coming. I see COPD coming. I see asthma exacerbation coming. Trust me, it is coming. It is coming. We are going to have to learn. It is in our best interest to giddy up and get involved. So let me let you know what is going on right now. So there are many reasons why it would behoove anybody to jump on this opportunity. And that is, one, you are put in a registry so the public knows. The public will know. Will know if you are participating in access and how you are performing with access. The public will know. So choose your technology providers accordingly there. But yes, the public will know. And then you are also an incumbent in this space. You become an incumbent and you're going to be ready and wired up and whatnot. Well, not wired, sorry. But you'll be ready, rock steady for whatever comes our way, because this train is leaving the station already. You can, you know, wait if you want. You can wait if you want and try to play catch up later on while your peers are reaping the benefits, or you can jump in now and be part of literally building this solution, because eyes will be on the performance of these of these folks. So there is that. I want you to know that this is extremely, 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 extremely exciting for me personally, because I've dedicated my life and my career to better outcomes for patients and health equity. Now, I am I do support technology, obviously, or provide technology to applicants. So feel free to hit me up. But there's a lot more to that, because for us, it depends on who wants to play. But for us, we also tie in equity and health equity. I will drop another video about how, actually, I did drop a video, I think, already on health equity and how value-based care largely is in the middle of a bell curve, and how it's easier for some people to achieve certain outcomes than other people. What we do with our model when you partner with us is we actually pay you to close the gap between those in the margins and those in the middle of the bell curve. We pay you to close that gap. So not only are you incentivized to produce results for your patients, but you're also financially, talking money, compensated for closing that delta and not leaving whole communities and patients behind. So more on that. If you have questions, comments, concerns, feel free to reach out to me. I'll put my email down there or something like that. But yeah, today is a great day, guys. And I promise you, again, of healthcare, this is now. And the time is now.